Hi everyone, welcome back to my YouTube channel. Today we are going to talk about ethmoid bone, and here at the side you can see the diagrammatic representation of ethmoid bone for the reference. So let's start our topic with introduction. Ethmoid bone is delicate sponge-like cranial bone located between the eyes, forming a major portion of nasal cavity and medial wall of orbit. Despite its small size, it plays a pivotal role in both structural support and sensory function, particularly relating to the sense of smell, location, and structural components. Ethmoidal bone sits centrally in the anterior cranial fossa, nestled between sphenoidal and nasal bones. It contributes to the anterior cranial base, the nasal cavity walls and nasal septum, the medial walls of orbit. Its strategic location makes it a keystone in cranium midline structure, connecting neurocranium and viscerocranium elements. Anatomical components of ethmoid bone. Anatomically, it has cerebriform plate, crista galli, ethmoidal labyrinth, and perpendicular plate. First, it has cerebriform plate. This perforated horizontal structure houses the numerous foramina, allowing the passage of olfactory nerves from the nasal cavity to the brain, as you can see here in the diagram. It forms the roof of the nasal cavity and contributes to the anterior cranial fossa. Next anatomical component of ethmoid bone is crista galli. As you can see here in the diagram, crista galli, it is a vertical midline projection from the cerebriform plate. It serves as an anchoring point for the phallic cerebri, a fold of dura mater that separates two cerebral hemispheres. Next anatomical component of ethmoid bone is ethmoidal labyrinth. They are little masses that contain ethmoidal air cells that open into the nasal cavity. They contain orbital plates forming part of medial wall of orbits. They are superior and middle nasal conchae, which increase surface area inside the nasal cavity and also aid in air filtration and humidification. Next part is perpendicular plate. As you can see here in the diagram, it is the descending vertically from the cerebriform plate. This plate contributes to the nasal septum, separating the left and right nasal passages. Functions of ethmoid bone. First is olfactory transmission, as cerebriform plate facilitates passage of olfactory nerve. Second is air filtration and humidification, as nasal conchae create turbulence to warm, moisten, and clean inhaled air. Third function is structural support, as they act as a structural bridge between facial and cranial bones, contributing to nasal and orbital architecture. Further, in clinical significance, there may be ethmoiditis, that is, inflammation of ethmoidal sinuses that are often caused by infection, resulting in pain, fever, and nasal obstruction. There may be fractures of ethmoid bone that may be due to its fragile structure. Ethmoid bone is susceptible to fractures from trauma, possibly causing CSF leakage or olfactory loss. Next, there may be olfactory dysfunction, that is damage to cerebriform plate and that can impair smell due to disruption of olfactory nerve fibers. Conclusion of this lecture video. Ethmoid bone, though compact, is anatomically and functionally essential. It plays a critical role in cranial structure, sinus formation, and olfactory transmission. Understanding its component and relevance offers insight into both normal physiology and potential pathological conditions affecting the cranial base and nasal cavity. And this was all about ethmoid bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.